Alrighty, well, good morning again. This is Dr. Bulow with Revive Upper Cervical Chiropractic, and all month long we're talking about chiropractic pediatrics. Well, this past week we've been talking about the number one reason that that adults, parents take their kids to see the pediatrician. The number one reason is actually ear infections, believe it or not. It's the number two diagnosis among kids, second only to the cold or the common flu. But if you think about that, ear infections, number one reason we take our kids to the doctor. Now, a couple other stats about ear infections. It's the number two surgery worldwide on kids when they put those tubes in the ears, which has some risk, and some studies show 30% of them totally unnecessary. But either way, second most common surgery. And in the United States, it's estimated that we spend almost $5 billion a year on ear infections. So ear infections are pretty serious, pretty common, pretty prevalent. And as we kind of talk about kids, last time we talked about colic and we talked about infants. This is one of the more common things we start to see in toddlers. Part of the reason behind ear infections, just to give you an idea, the tube, see, this is supposed to be the ear right here. The middle ear, which is what helps you hear and also balance out your world, drains any excess fluid through the eustachian tube, goes down the back of your throat. In kids, that eustachian tube is relatively flat, so the fluid actually can build up in there, and that's what can get infected. As you get older, it starts to come down, so it drains easier. So ear infections are a bit more common in kids than in adults. But either way, when this happens, you have to try and consider what your options are, right? Usually in kids, the first go-to treatment for an ear infection is antibiotics. Sometimes it works, sometimes it doesn't. But either way, antibiotics are going to have a toll on that baby's stomach, on that kid's stomach. And a lot of times it can lead to super bacteria, super germs, and a decreased immune response just because the natural gut bacteria have been kind of eradicated by the antibiotic. Sometimes we need this stuff, but other times we have to ask ourselves, well, what other options do we have? One of the options that we are obviously talking about this month is chiropractic pediatrics. And you'd think, well, what does chiropractic have to do with the ear in an infant? Well, the way it works is this. That tube, the eustachian tube, that drains the fluid out of your ears, will open and close based on different factors. One of the factors is this muscle. It's called the tensor veli palantini. Pretty extensive name, so I just called it the TVP. That muscle, when it contracts, helps to open up the eustachian tube. It also helps to raise the back of your throat, the hard palate, which is why when you yawn, right, did any of you yawn just now? When you yawn, it opens up your ears. When you swallow, it opens up those ears. Like when you're flying in a plane and your ears are pressurized, if you swallow, it opens your ears up. Well, why is that? Well, when you swallow, you raise the back of your throat, but you also open up that eustachian tube. Well, that muscle, the TVP muscle, is controlled by a cranial nerve. One of the nerves that come off the base of your brain and come from the top of your neck. The cranial nerve number 5, the trigeminal nerve. So when we see kids in this practice, one of the more common symptoms that we see, like any other medical office would see, are ear infections. And let me tell you something, these kids do really, really well. And we could talk and debate about how and why, and at the end of the day, it almost doesn't matter. The bottom line is they do well, and there's no side effects, there's barely any risk at all. When we talk about specific, gentle, and scientific chiropractic for children, it is just that. It is very specific, it is very gentle, it is very scientific. Because we don't go in guns blazing just because. We go in with a neurological assessment, a structural assessment, to see if there is a structural imbalance in your spine, something we call a subluxation, that's irritating the communication between the brain and the body. In this case, the brain and the tensor veli palantini. So, if you know anyone that has these toddlers that maybe when they go to the daycare, they're just chronically getting the same ear infections again and again and again, or they've been on rounds of antibiotics and now they're told that they have to have tubes put in their ear. Or worse yet, they've already had 2 or 3 sets of tubes and the kid's still having ear infections. Please share this video with them. Please let them know they do have options. Maybe, just maybe, there's an irritation upon that nerve irritating that muscle, not letting it do its job right. Those ears aren't draining, so that child is always getting infections from the fluid buildup in their ears. That would be a great referral, a great person to see a very specific pediatric-minded chiropractor. We would love to be that person for you, but if you're not in our region, please post your information in the comment section below, and I will seriously help you find someone who is in your area that can help you out. So hopefully this video was beneficial to you, and we'll continue to do more like it, and we'll talk to you next time. Bye now.